Good afternoon, everyone. Thank you for joining us. My name's Adrian Carr, and I'm the... What am I? Has anyone got my business card? SVP of Global Enterprise Sales. And I'm not from around these parts, if you're guessing the accent. But even though I live a long way away, the next subject was very much news in Europe and around the world. And the Affordable Care Act, or Obamacare, everyone's got a point of view, and the politics is still raging. And we've all read the press and so on, but in the middle of this was a group of IT professionals, a man, a team, his partners, who had to get a job done. We've all been there before. And that man was Henry, and it's a great privilege to introduce him, the former Deputy CIO, Deputy Director for Center for Medicare and Medicaid. So without further ado, Henry.
Thank you. Good afternoon. So I'm going to spend a few minutes going over kind of the history of how I arrived at working on the so-called HealthCare.gov. I believe it contributes to understanding the context of why some decisions were made. I also will quickly go through the slides. I hate reading from slides. I hate sitting from my own experiences of sitting in the audience. I only have a few, and I'll kind of blaze through them. In fact, I might not even necessarily refer to them verbatim. I kind of understand and lived this story for many years. And no matter how many different ways I emphasize certain aspects of it, the underlying story never really changes because it's the way it happened. I started working at what used to be called the Healthcare Financing Administration, or HCFA, which is the previous name for CMS. CMS had a rebranding effort around 2001 so that it would appear more provider-friendly and approachable, because it seemed like it was a giant bureaucracy, of which, believe it or not, this agency that runs Medicare, of which there's about 55 million people enrolled in Medicare, Medicaid co-administering with states, and there are about anywhere between 55 to 65 million, depending upon the eligibility changes that actually can happen month to month. The Children's Health Insurance Program, which has about another 3 or 4 million enrollees, and then with the Marketplace Program, as of last year, about 11 or 12 million enrollees. Right. So this one agency, you think it's really, really large. It's not. There's only 6,000 federal workers in CMS, kind of spread across 12 offices around the nation. And the 6,000 that work at CMS, they leverage that smaller workforce to manage a 60,000 plus contractor workforce. So most of the operations, maintenance, application development, data center hosting, it's all outsourced. And so a lot of folks in CMS are contract managers. There are still some, though, that are kind of what I would call the big IT folks, that understand these large-scale complex systems. And I grew up first in the Medicaid side, working with states and understanding how you have to handle a lot of diversity, and states see themselves as very unique from each other. Which is why states don't really pool their investments together. It's very difficult to do that, both from a policy perspective as well as an IT perspective. Then I moved over to Medicare and started working on enterprise architecture. And I was immediately drawn in, or someone actually pulled me by the collar, the CTO at the time, and made me the systems implementation manager for Medicare Advantage and Part D during 2005 2006, where that program was the largest change in Medicare since 1965. And it resulted in 28 million beneficiaries enrolling with a prescription drug benefit in the first year. It's probably north of 30 million right now. So this is all to say that I incrementally always found myself like a bug attracted to a light in the middle of the night to very messy, complex challenges. And even though, after I finished the Part D implementation in the stabilization period, because it was not very, very calm and clean and just kind of, launched with no issues, Certainly there were millions of lives affected by bad data. And so you immediately, after you launch, you have to then stabilize and you have to correct the deficiencies. So when you're rolling out these national policy programs, there is no such thing as a successful rollout, as in anyone could actually define what success looks like across the spectrum of stakeholders. But the key thing is to always maintain this focus and to believe in yourself and take the risks where you have to, because you're not really taking those risks, on yourself. You're taking it on behalf of all the people that will benefit if this program launches, right? So you have to really kind of continue to always keep that in mind when you're working on these situations. I actually was promoted and selected in the Senior Executive Service in 2007 to be the Chief Technology Officer at CMS. And some would say that that's kind of like the last step, the pinnacle of your career before you retire. I was a CTO for about a year and a half, and there was initial talk about the Affordable Care Act, and when it became real, when it was signed into law in March of 2010, lo and behold, because I understood and I helped with a lot of the planning and cost estimation and what kind of delivery mechanism, the IT that was needed to support the delivery mechanism, I volunteered to join this new office and left my so-called fairly comfortable, it's like a tenured professor, right? You're a CTO, and decided to start a new organization with no budget, no staff. When I showed up, there were 3 people that helped me begin this organization. And for me, it was a departure from CMS. I went to the Office of the Secretary to start what was called the Office of Consumer Information Insurance Oversight. This office, among other things, had to tackle very early challenges such as early retiree reinsurance, pre-existing conditions, insurance program. These are things you never hear about because they're kind of obfuscated by HealthCare.gov. But ACA actually has 468 sections in it, of which the marketplace program is only about maybe 24 of the 468 provisions. So a lot of other things are happening, and so I went off and began working for this new office. And in 2010, in the fall, there was a House election, and the Republicans won the House, and the administration decided that it was much more, I think, safer to put this organization inside CMS, which is a huge, complex, multi-funding stream, huge organization, right? So, like, for example, CMS's program budget and program outlays exceeds $1 trillion a year. So it's like 1/17 of the GDP, okay? One little agency. So for me, it was going home in January of 2011. And we started, leveraging, kind of CMS had the infrastructure, so to speak, of contract, budget, and started kind of working through this process of developing and actually making real the underlying design and the budget that needed to pay for the contracts that were going to be awarded. So all during this time, I think, this very simple slide about business challenges. It's not just focusing on establishing a set of capabilities for delivering a new way to access affordable health care, but the entire healthcare industry had to be transformed. And this is another thing that gets missed, right? So in 2010, you could buy insurance online, health insurance. You can go to a number of websites, ehealthinsurance.com, and you could fill out an enrollment form and submit it, but you wouldn't be covered right away. There was a long, grueling underwriting process of which there could be a medical exam involved. You could be denied for pre-existing conditions. And then the ultimate price that you pay for the premium that was only estimated for you when you initially submitted the application online could be drastically different. And with the advent of HealthCare.gov and this consumer experience of purchasing healthcare, health insurance online, with the appropriate, premium tax credits, subsidizing their premiums, is a huge undertaking because you have to take all those very slow insurance back office operations and you basically have to light a fire under its butt. And so for example, the average time for developing an insurance product going through the state's Department of Insurance to be sold in the marketplace is typically about anywhere from between 8 to 15 months. We were asking the insurance industry to come up with their products and submit it in a new way, an automated way, into a single point of entry for most states in something on the order of like 4 months. And so, the business process reengineering that occurred is also lost on many folks. And so the first order of business, right, when you're operating a retail storefront, right, you can't open for business if you don't have what? Inventory. So insurance products that are vetted with departments of insurance, goes through the rating process, evaluated by policy people to be adequate in terms of network and coverage, all of that processing had to occur in a short amount of time so that you would have product on the shelf when the first person entered the door. So you can't work on enrollment without having product. So we got that part done. And then, which kind of took a lot of time, and then we started working on, kind of eligibility and enrollment. Budgets were very, very slim. I think for the first 11 months, we were living on a allowance, basically. So a few $1 million a month. You can't really award any big contracts. You could purchase some services such as strategic advisors like MITRE Corporation to help you do business process modeling and such, right? So the whole idea of this kind of previous experience, I mean, the title of this session is about applying lessons learned. It's more about, I think it's more accurate to say, it's all the lessons I learned from the previous 15 years watching how large-scale programs get launched, that then I use those lessons to apply to so-called HealthCare.gov. And I immediately recognized that if you're given a certain amount of time, and in government, it's all about implementation, right? No one changes the date on you. Like if Congress or the presidency says, thou shalt launch on this date, almost never will you get any other dispensation, okay, no matter what you say. And this is exactly what happened. So budget, contracts, timeline, everything was a huge challenge. So here is a timeline that I created to kind of try to illustrate the issue here. A lot of folks, laser doesn't work. Okay. So a lot of folks are asking the question, well, if the law was signed into by the president in March of 2010, and you had to launch on October 1st, 2013, well, you have 42 months to work with. What's the problem? Well, just to give you a little kind of high points, I didn't get a budget until April of 2011. You cannot put a contract on FedBizOps unless you have money. The government has this thing called the anti-deficiency law. It's like you can't ask for services without actually having a budget to pay for it. So same thing with contracting. Right? The initial contract was awarded for the federally facilitated marketplace, which is one major part, the eligibility enrollment side that as healthcare.gov. And then there was a data services hub, which is the other very, very complex, large-scale operation of which you don't hear anything about, right? You only hear about healthcare.gov. And I'll talk a little bit more about data services hub. So the Data Services Hub contract was protested and wasn't awarded until January 2012. Guess what was happening between January 2012 and January 2013? There was a presidential election. So given that Obamacare has come up at that time, I think in total it was like 46 times it came up for repeal. I think by that time it was probably in the 30s or maybe 20s, right? So, people knew that if you put yourself out there by publishing regulations, issuing policy, being very public about the program, that all would happen was that you would be subjected to lots of attacks. So there was a lot of hide the ball, so to speak, right? So insurance companies, the stakeholders at states, they were very frustrated because you couldn't get accurate, detailed information about what the program was going to look like. This is like a huge danger sign, right? I tell folks that there's even, we came up, anybody ever looked at, data flows, business process models? They're fairly complex. And I chuckle because, I show some business or policy people what they look like, and they fall out of their chair. They're like, we can't show this to anybody because it's too complex. Well, healthcare in this country is pretty complex. Okay, this third-party system that we're under is hugely complex, or any healthcare system is. And so there's kind of this shyness about, okay, what are the details associated with it? And when you do that, there's this kind of pent-up demand for information, and guess what? Time marches on. You lose time. You don't have enough time to work on it. And by January 2013, the actual online enrollment form that has all the questions and the sequencing and the business logic associated with it did not come out until January 2013. So really, healthcare.gov only had about 10 months worth of time to develop. Most of the other time was spent towards what I call buying down risk and taking care of making sure the product was on the shelf. So, this is kind of the fundamental pillars of project management: time, cost, and scope. Well, I didn't have enough time. Certainly there wasn't a lot of money, and the scope was forever changing. If you know that that's what you're heading into, what's the first thing most people do? They bail, they run. I started the program with 11 senior executives. By 2013, January, I was the only original one left. So, well, maybe that says something about me too, so. Masochist. I felt this obligation that, you really had to see this through. To drive something this large, it has to be emanated from some, leadership, some vision about how it's supposed to look like. And after all, if people are not making decisions or not giving enough detail about requirements, time actually decides it for you. If you don't move that date, then you have to go with whatever you have. The trick is, if you know you're heading into that, what are the most important pieces that you have to deliver? So on 12:20 a.m. October 1st, the government, by the way, the federal government was in a shutdown. So it wasn't like there was a big White House situation room, with lots of people, watching dashboards. It was myself, about 5 or 6 members of my team, and a few others that were key in launching this. So at 12:20, we said, go ahead, release the URL to Akamai, and within 4 or 5 minutes it begins to propagate, right? And by 12:40, you could see Google Analytics. You probably came to visit the website because we had traffic from every corner of the world. And within the first 40 minutes, you could tell you were having a meltdown. I mean, it was probably 200 times more traffic than we had envisioned. And this was just people who wanted to come in and just try it out, see what it looks like. And which is not bad. I mean, so that's really the ultimate, kind of user acceptance testing, I would say. Unfortunately, but people kind of look at me with this kind of crooked eye and say, "What do you mean? It worked?" Well, it enrolled 6 people the first day. I don't care what you say, but if it enrolled 0 people, as some other programs have done, the noise that would have kind of cast such a huge shadow over whatever it was that you were doing. You would have to spend all your time defending yourself about why a system wasn't up and running. And I myself had testified before Congress just that summer, stating that I promised that there'll be something in place. I muttered under my breath, though. I said it'll be really ugly, though. And that's why I basically told everybody else. The key here is knowing, how to prioritize, knowing that, if you need to keep that plane in the air, you got to throw everything out that you can, and there's some hard decisions to be made, but you have to launch. That's the bottom line. So going back now, all that experience that I had, well, standardization, uniformity, appropriate technology for the task at hand. I met up with, over the years, many projects in which I had the guys that were Oracle champions, DB2 champions, Java, CICS, whichever. Every flavor of technology somehow, and maybe you have this in your organization too, has a champion associated with it. They are so passionate. It is their livelihood. It is what they do on a daily basis. It's what they trained for all these years. So when you're looking for a solution, a lot of times these very passionate people, and I don't fault them. I just, I just question, before you jump to the conclusion that sure, DB2 will work, sure, Oracle will work. You have to think about, well, what's the underlying situation, right? So what's that situational analysis? Like, I didn't know it was like 42 months and I'll have 10 months to develop. I just knew that it'll be a very, very small time frame I'll have. I knew that requirements will come very slow, if any at all, and testing will be a huge challenge because you won't be able to do this full integration test that you're supposed to in many cases. So how do you kind of buy down the risk that you're heading into? Well, one of the things that I learned as a CTO is you implement what I call a reference architecture. So a group of 3 or 4 of us that have architected systems as CMS before sat down and decided that, first off, we're going cloud computing, which was actually pretty immature at the time. But nonetheless, there was a big push by the federal government to go cloud computing, although no one actually laid the tracks for it. They just said, thou shalt try cloud first, is what Vivek Kundra said, right? So we contracted a small initial contract with TerraMark, which is now owned by Verizon. And I had toured their data center. It's the first data center. I've been to about maybe 50, 60 data centers around the country. It's the first one I've ever visited that actually from the ground up was built to be a cloud computing data center. I'm sure there are other ones now, but at that time in 2010, it was the most impressive one I could find. And and then you begin to discover and you shake out, like what exactly is infrastructure as a service? It's at that time was mostly a contract. It didn't mean that there were specific quantities of anything, compute or storage. You had to define that yourself. Then the security people came along and said, no multi-tenancy, you can't be on the same hypervisor, because they're still working the physical world, right? You can't share anything, right? So had to take it out of the multi-tenant space, pay all the expense to create a private cloud, but we were still in the cloud. Then we built platforms as a service, right? So we used CollabNet, for TeamForge and to manage source code, because we needed to share with states, what progress we were making, right? Then on top of that, we determined what the lowest level of the software stack, OS and such. Picked Red Hat, Java, and MarkLogic. And you can do these things because the unique requirements of the application level functionality further up the stack, you can always wait until later. If you wait for each contractor that you put a contract out for to come back with their own bid and their own design, they will take from the network on up whatever they have optimized in their company, right? And so what typically winds up if you have 6 or 7 contractors that are bidding, you get 6 or 7 different designs. And what I was trying to avoid from the previous experiences, that kind of diversity. If I could enforce the lower levels of the architecture closer to the so-called infrastructure and network, I can achieve some consistency and get some early wins so that when requirements were ready, application developers would come in and just worry about the software requirements, the application level requirements. And I think that really, of course I'm biased, right? I mean, that's what I did. Really brought down a lot of risk because although I would have to say at that time with the amount of debate I had to go through about choosing a reference architecture, there were so many people that wanted to kind of tag their own technologies in there, and got a lot of pressure. But you really kind of again stay focused. You have to understand and believe in yourself that you know how this is going to work. You commit to that. You stick with the design, and even the contractors that were eventually brought on the federally facilitated marketplace side, they were fighting, screaming, kicking, didn't want to do it, but ultimately they did. And then on the data services hub side, these are guys that just said, okay, we'll do it. And at the end of the day, you don't hear anything about data services hub. It's built on the same reference architecture in the same environment at Terramark and didn't have a meltdown. And the reason why I say it's complex is that part of what ACA's requirement is when you are checking the eligibility of an applicant, you have to verify against authoritative federal sources of data. So first thing being, is this a valid social security number that you're entering on the application? There's a service that goes through the hub and calls SSA and checks that. The income that you put on the application, it does a comparison by looking up, it's a service call to IRS for line 14 of your last year's tax return. If it's not relevant or it's not timely, you can always provide other sources of income proof. Lawful presence, incarceration, date of death. These are all authoritative sources at the federal level that the marketplace itself could not render a judgment on, right? So you have to hit up. So all these services, typically the way it's checked between Health and Human Services programs, let's say, between states and the federal government is that they individually negotiate point-to-point interactions. SSA in 2010 told me that they had over 2,000 interconnection agreements to maintain. There's only 50 states in DC and territories, over 2,000, because each program creates a new data exchange, it's funded by a different line item, and so a lot of people are like, why is the government so inefficient? Well, you know what? It's not the tech guys that are making that happen, although I have to, I'll take part of the blame. Part of it is you can't commingle certain funding sources. If the money comes to us for Medicaid, you got to spend it for Medicaid. If it comes to us Medicare, you got to spend it for Medicare, even though 15 million people are actually in both programs. So this fueling of this kind of like diversity of implementation is just unmanageable. And I didn't want to kind of just add to that, right? Again, taking my previous experience. So when I talk to SSA and IRS is a little skittish though, you have to really coax them out of the dark. Serious, when I mentioned cloud computing, they basically shut their doors and they don't want to talk to me anymore. I get it. They have some very serious, kind of operations to maintain and you don't want to endanger it. But SSA, on the other hand, was very, very welcome. SSA was like, oh my God, you mean I don't have to negotiate with 51 more times in addition to what I'm already maintaining? So they saw the benefit right away. And I think eventually everybody else did. And in terms of being able to automate those services against those traditional interfaces of which that authoritative and legacy data is sitting behind, and you're kind of creating this real-time interaction that's driving towards this user experience of sitting in front of a browser and going through an online application and having a decent experience and making sure that the requirements are all being met, starting with authenticating the individual. The federal requirements is that if you access a federal system, we have to know who's touching the keyboard, right? So you go through a remote identity proofing process, just like your bank does, with Experian or Equifax. And you kind of move through this process, and the hub is in the background going out and getting all this information to do the comparison. And it's dynamically being driven and hit up against these set of services. This hasn't been done in government ever. And I spent a lot of my time after the implementation to try to convince government organizations to leverage that design, because think about every program that needs to talk at the state level to the federal level and how much efficiency can be created, right? So the notion of a hub has been around forever. From the days of someone sitting at a switchboard and connecting plugs to where you see, it has kind of evolved today to be big data integration type operational data integration implementation. So the DSH is very, very much just an example of the benefits of the Data Services Hub. So all that was part of the reference architecture. I literally drew the architecture on the back of an envelope. I'm serious. Someone on my staff probably still has it. And really, it's this idea that you carry forward. I learned all about integration and data hubs during the, has anybody worked on the ONC programs, the interoperability and health information exchanges? And look, yeah, that's no small feat, right? And there is still no national health information network because it's that difficult. But it's through those experiences you understand security, privacy, disclosure, managing, roles, access, authentication, who could send data, who could receive data. All those things that were learned are then applied in what you see in the marketplace today. So eventually, what's the outcome? As of today, it's probably, this is always approximate, 12 million plus people are accessing healthcare, either through a state-based marketplace program, through a Medicaid expansion, Children's Health Insurance Program expansion state, and the federally facilitated marketplace. And MarkLogic has been optimizing and tuning this configuration and scaling it to this open enrollment. I think in December it hit 280,000 concurrent users. So no question about it being kind of scalable and enterprise class. I think it's more about what you wind up is going to kind of look, someone who looks forward and says, I'm encountering a lot of risk. What's going to buy down that risk? And I think using MarkLogic as an example is that when you're not going to get requirements, are you going to be able to build a very sound relational model? Between July of 2013 and October 1st of 2013, there were 180 builds of the system. If it was built on relational, do you think relational could have kept up with 180 builds in 90 days? We had literally 2 builds every day. Scrambling, 11 development teams trying to catch up with the minimum requirements in order to launch on day one. It was a tremendous effort, I have to tell you. A whole bunch of us lived in Herndon, Virginia for like 22 hours a day, every day for 7-8 weeks just to get this thing to launch. So it was a massive effort. And I'll tell you, anybody that's ever been involved in something like this, it's a fabulous experience. I mean, even the part about having to go to Congress multiple times. For every hour you saw me on C-SPAN, I spent 10 hours behind the scenes getting grilled. And having the Republican staffers try to beat me up. And even that was fun. It really is a fabulous experience. I mean, if you ever have an opportunity to work on these complex, large-scale projects, public policy implementation, not just 100% margin and revenue driven, it's about a will to put in place programs that actually help people. It's a fabulous experience. 21 years at CMS, and it was like a blink of an eye. And I didn't know what to do with myself afterwards. Like, I retired because what am I going to do next? So I come out to the commercial world and help everybody else and share these stories. I think that it really, really warrants this sharing of this experience, because it isn't really about the technology. It's whether if you understand the business problem. What problem are you trying to solve? Stop debating and start doing. Take the risk. I think that's kind of it for now. I can take questions. You want to? You might want to use the mic so you could hear it on the.
This, so if you're able to use the mic, that'd be great.
Well, thank you very much for the great illustrative lecture. I'm curious if you could speak to the redesign effort that occurred and the role of 18F and other advisors that came out from Silicon Valley to improve the overall efficiency, and what they contributed, what may have been hyped in that process?
Fabulous question. Anybody ever see the Code Red article in Time magazine? Yeah, that's a kind of a fantasy and reality kind of mixed together, you know. On October 27th, Chief of Staff at the White House, you know, and Secretary, everybody, of course, is very concerned, very dismayed at how the program rolled out. And they were trying to figure out what was wrong, so they brought Jeffrey Zientson and then subsequently Todd Park, who I'd been working very closely for probably 3 years, brought in you know, some folks to help out. And in the, you know, kind of Code Red story, there's this famous, you know, Friday van ride in which they, you know, circulated DC. The first stop was with the administrator of CMS. She said, go ahead. You know, that was like early in the morning. 10 o'clock, they came to Baltimore. I sat down with the first crew and walked them through the systems architecture and where the problems were. By 3 o'clock, they were at the operations center meeting with the lead developers and getting their take on what the issues are. Then I met them in Herndon at 7 o'clock at night. First order of business was a couple of the companies wanted to sign NDAs so they didn't talk bad about them. And we got to work. We started instrumenting the systems that very night and largely started focusing on driving, you know, kind of this performance model that had not been there. We had an operations center, but I think you know, folks like, you know, Mikey Dickerson helped out with trying to create the discipline around managing production operations in such a big, you know, kind of complex launch like this. So that helped. I think the folks that came in subsequently, you know, were really focused on the outer edges of the system. How can you improve it without changing the underlying source code and software architecture? So the first thing you do is, you know, we created, well, it was already designed into the system, but we started using sharding like you wouldn't believe. I think at the highest point we had something like 28 shards, whereas the day to launch it was only maybe 2. So sharding was, and throwing more VMs at it probably is, you know, if you want to have a debate about efficiency, it probably wasn't efficient, but it got the job done.
Were there any front-end changes to the browser code?
There was some usability changes, particularly with trying to stand up what I was accused of hiding the high premium rates because I didn't allow anonymous shopping. And I kept on saying I didn't allow it because it failed miserably, right? Why would you want to quote somebody the wrong, you know, kind of insurance premiums if it's not working? But instead, you know, the conspiracy theory is that I was hiding the high prices. And so they started working on those features, but offloading it from the main system and doing it offline. So really kind of a simulation kind of exercise. And then there was a talk about the so-called Marketplace Lite that you're mentioning, or App 2.0, which is built on, you know, I think it's either Node or it could be even Go. It's a, you know, the lighter language framework and built at AWS, and to first focus on the more simpler applications. The, you know, folks that come in, they don't ask for any financial assistance. They just want to enroll. Likely, you know, a demographic would be a young person who never gets sick, just wants a high deductible plan with a very low premium. And so we streamlined that application process and just kind of took them straight to the product selection or plan compare. And so Marketplace Lite, you know, taking that approach, began to offload the traffic from the main application, which is kind of like I call the pig in a python, right? You know, slowly moves through, only one way in, one way out. Right? And I think, you know, it's that a lot of folks came in and spent, you know, time, you know, helping out. To this day, they're still, I think, increasing the investment on the Marketplace Lite, which follows, you know, kind of the 18F, you know, kind of approach. You know, try to keep things simple. And I think you can in many cases, but there are some deep, you know, rooted policy complexities that that approach sometimes comes to head with, and so I think eventually it'll work out. It's a different perspective. It's help that's never turned away. Prior to October 27th, I had asked for lots of help, and no one sent any. So help is welcome.
Sorry. Just a quick question. Of your lessons learned and use cases here, probably an active thinker like you has thought, where else could I apply this in healthcare? Are there any obvious adjacent things in healthcare where this same success can be replicated, or maybe even things outside of healthcare from a consumer perspective?
I think I think healthcare in this country is wrought with kind of opportunities for improvement. But you ought not to like kid yourself that doing any one thing is going to improve the delivery system in terms of access, cost, quality, and timeliness. Healthcare is so subjective, and it's so wrapped up with what I call the overall well-being of an individual, that it isn't just about your healthcare. It's about where you live and your education, and are you in need of housing or energy subsidy. It's a big complex kind of ball, but there are some things that can be done absent legislation or policy directives. I think as operations focused folks, you can look for efficiencies such as improving the latency that exists in a lot of data exchanges by building hubs and having the hubs abstract away from organizations and systems that can't deal with the complexity. So it allows them to talk to one interface rather than everybody's request, and supporting that. So I've mentioned to states that you should build a state level hub that talks to the federal hub, right? Then you could redistribute those transactions at the state level, whether in real time, batch, however you want to do it. You just have to have the security and privacy. Well, I shouldn't say just. You have to have the security and privacy aspects of it, kind of agreed to. I've talked to Blue Cross Blue Shield Association, which operates Blue Exchange, which is a huge backbone that supports the 39 Blues. And I was trying to convince them to build a hub on their side, so I wouldn't have to. The hub wouldn't have to send EDI transactions to 39 different plans. So I could just send it to the Blue Cross Blue Shield Association hub, and they could distribute. But a lot of folks, without a big mandate, without a mass infusion of cash, they likely don't want to do these things. They wait for opportunities to come along. But I have tried to do some things to push the envelope a bit. You want to?
Here we go.
I was going to ask, what was 18F, and do you have a blog site where you expose all your learnings, lessons learned, and wisdom?
That's why I'm an independent consultant. Yeah. A good question about 18F, because when they first came out, I worked with a lot of those guys, and I was like, 18F, what the heck is 18F? Is that like some subsection of a law in GSA or regulation? It's not. Their office is at the corner of 18 and F Street in DC. Okay. That's 18F. And you can subscribe to their feeds. And they tell you about how they've gone to various agencies. They're actually pretty embedded in CMS now, helping agencies to do agile, to kind of take the less complex work, such as UX, UI design, and put it on a different track so it doesn't all get bogged down in the same same work. There's a couple in the back.
I wonder if you could explain what was the role and the selection process for MarkLogic for this project.
That's a good question. I'll answer it for like the 5th time today. Okay. It goes back to the way I describe how up to the time I went to work on this program, as the chief technology officer, I implemented and ran a lifecycle management process, a governance process, which had a technology review board, which is like most organizations have some kind of an architecture review board. And you apply this enterprise kind of view into the process. So you do things like preliminary design review, detailed design review, operational readiness review. And so you're helping the project teams to kind of stay on track, stay Don't create more diversity than there is. Stay with the standards. Leverage things like enterprise licensing agreements. But at the same time, the flip side of that, right? Driving everybody towards standards and uniformity. You have to remember that if it takes you 5 years to have that nice little Craftsman toolbox that has all these drawers in it, with the cutouts for the tools, but if that toolbox is all hammers, big hammers, little hammers, medium-sized hammers, everything in the world looks like a nail. All that is to say is that you have to sometimes, when there are large complex projects that come along, you have to step back and you say, what's really going to do the trick? And it isn't about requirements always, right? And I was trying to explain to somebody else that you have to look at holistically. If you, let's say if you knew that of 42 months you were only going to get 10, you would not invest in technology that you could not fit within that 10 months. I didn't know the exact number, I just knew it was going to be very, very little. So MarkLogic was key because, to me, the attractive aspects of it, and back then I didn't even kind of think about no SQL. It's a document-based database, and what I was working with this online form is essentially, it's a document. It's a document with attributes that if I couldn't process an application of everybody in that household in the primary system they enter, I had to pull those people out if they had other eligibility and send them to the state. Right? So I wanted to be the best chance to preserve that data as it was filled out in the application so that the family that applied would not have to reapply again. Right? But the most important thing is still the ability to adapt and absorb, right? No relational models, no model to really worry about, right? It can kind of just go with as you learn and as you're getting more requirements, you're building as you go, and it can adapt, over time. And especially this very kind of uncertain and volatile situation. So that's the reason why. And I think a lot of it is being discussed now is, the legacy I left at CMS is that, find the right technologies that suit the need, that solves the problem. Don't debate about what's better and what's not, because that has no meaning if it doesn't solve the problem.
I totally appreciate that whole philosophy, but was there some kind of demo there, some kind of like use case or some kind of like, let's do a prototype to see if this is actually going to work? Because at that time, even at that time, we've been with MarkLogic for a long time, but even at that time when you did that, it was relatively new and a scary thought. So how did you do that?
I took the risk.
Took the right medications or... just took the risk.
And whatever I didn't have, I eventually got my primary care doc to write a script for me. No, I've had the fortune, and I think I maybe have not emphasized this enough, of being in a lot of messy situations and being the CTO. CMS has more than 375 systems. Those systems pay out that over $1 trillion a year that you're talking about, that handle eligibility for 130 million people. So I've seen various implementations of which relational worked really well, okay, and where it did not. I've seen, this situation where people thought, this very expensive MPP technology would get them the data analytics that they need, and my perspective was, okay, why can't it be both MPP and Hadoop? So, it's this instinct, and this is why I say you have to trust yourself. If you've been doing this for a while, you know what's going to work, and you know how you can make something work, right? Because every system that's deployed is not perfect, and it's forever evolving. Software is forever evolving and changing, and someone has to always make sure that it works as intended. So it wasn't that I was worried that MarkLogic wouldn't work. It was more that I was worried that the relational products would not work. And I knew that with evidence of observing so many systems that have so many problems, present day.
That's brilliant. That's probably a wonderful place to stop. I think, the point that Henry made there is really valid, that for every one of the MarkLogic or even NoSQL customers out there, somebody at some point has taken a step with a little bit of risk, or maybe a big bit of risk. but the knowledge that what was in place and the toolbox of hammers was not right has, in most cases, been a justification for that. But it always comes down to one person eventually saying, I'm going to lead here. So it's been an absolute privilege to be part of the program. So thank you.
Thank you.